Okay, let's dive right into this explainer and see how we can finally tackle that debilitating knee pain. Because let's be honest, whether it's this dull, annoying, nagging ache that just won't quit, or a sharp, sudden pinch when you take a step, knee pain is incredibly frustrating. It literally stops us in our tracks. And we always kind of blame it on getting older, right? But the reality is, this stuff strikes at absolutely any age. So in this explainer, we're going to look closely at 15 highly effective, all-natural home remedies drawn straight from clinical orthopedic insights. The goal here, to help you find real relief, support your body's healing, and get your mobility back.
To keep everything super actionable for you, we've got a 5-part game plan today. 1. What's causing the pain? 2. First-line physical relief. 3. Healing from the kitchen. 4. Movement and body mechanics. And 5. Knowing exactly when to seek professional help.
All right, let's kick things off with section 1, what's actually causing the pain? We have to identify the root culprits before we can fix anything.
So, knee pain usually traces back to a few primary offenders, the usual suspects, if you will. You've got arthritis, specifically osteoarthritis, which is essentially the physical breakdown of your cartilage, leading to all that stiffness. Then, of course, you have sudden injuries. We're talking ligament tears, meniscus damage, fractures. But listen, it isn't always some dramatic sports injury, right? Sometimes it's literally just overuse. It's the repetitive stress of standing at your desk or chasing toddlers around the house all day long. We also see things like bursitis. That's when the fluid-filled sacs around your knee get inflamed, and tendinitis. So the key takeaway here is this: whether your pain is from everyday wear and tear or a very specific strain, understanding what's going on under the hood sets the perfect stage for picking the right remedy.
Moving right into section 2, first-line physical relief. These are the immediate actions to take the second that pain strikes. When a bad flare-up hits, your very first line of defense needs to be a structural reset. Step 1 is almost too simple: rest. Giving your knee a break prevents you from aggravating it further. But you immediately want to pair that with step 2, which is elevate. By propping your leg up above your heart, just throw some pillows under there, you actively help drain away the fluid buildup that's causing all that throbbing pressure. And then, step 3 is compress. Slide on a gentle knee wrap or a sleeve for some much-needed stability. When you combine rest, elevation, and gentle compression, you create this incredibly powerful, immediate protocol to rapidly drop the swelling. Just a quick pro tip though, do not wrap it so tightly that you restrict your blood flow. Okay, next up in our physical toolkit is temperature therapy, and it is so crucial to understand the difference here. Just remember this golden rule: ice is for the sudden shock, heat is for the chronic block. If you just tweaked your knee, grab an ice pack, wrap it in a cloth, and apply it for about 15 to 20 minutes. That's going to numb the acute pain and shut down immediate inflammation. But if you're dealing with that stubborn, chronic stiffness that just lingers for weeks, ditch the ice and switch to heat. A warm compress is going to relax those tight muscles and fundamentally open up your blood flow, which brings all those good healing nutrients right to the joint.
Oh, and if you really want to level up your heat therapy, you have to try an Epsom salt bath. Epsom salt is absolutely loaded with magnesium, which is a mineral practically famous for relaxing muscles. When you dissolve a cup of this stuff into a warm bath and just let your knees soak, wow! The deep warmth combined with the magnesium physically penetrates the skin to melt away severe tension, stop muscle spasms, and massively soothe that joint stiffness. It is just incredibly relaxing.
All right, on to section 3, healing from the kitchen. We're looking at internal and topical remedies hiding right in your pantry.
So we've treated the outside of the knee, right? Now let's treat the inside. Your spice rack is honestly a medicine cabinet in disguise. Take turmeric. Science consistently shows us that curcumin, which is the highly active compound inside turmeric, is a total powerhouse for putting out the fire of internal inflammation. And when you pair that with ginger, which brings its own natural pain-relieving qualities to the table, you've got a seriously potent remedy. You can just toss these spices into your morning smoothie or steep them in a tea to fight that inflammation from the inside out. Now, if you thought cayenne pepper was just for making your chili spicy, you are in for a surprise. Cayenne contains something called capsaicin. This compound has been actively shown to reduce pain by literally intercepting and blocking the pain signals being sent from your knee to your brain. It's wild. But you don't just sprinkle it on your food. Actually, wait, you can eat it. But for your knee, you want to mix a little cayenne pepper with some olive oil to create a natural topical paste. Massage that directly into the joint to boost circulation and block those pain signals. But hey, seriously, wash your hands thoroughly before you even think about touching your eyes. For sure.
Need a tastier option or just a great excuse to eat more fruit? Grab some fresh pineapple. Pineapple is packed with bromelain.
This is an amazing natural enzyme that has proven anti-inflammatory properties. Just eating fresh pineapple, or even taking a bromelain supplement, is a super simple, delicious way to dial down the swelling and actually speed up how fast you recover from a knee injury.
To round out our kitchen toolkit, we have 3 more absolute essentials. First, apple cider vinegar. You can drink it diluted in water or rub it on topically to reduce swelling, and even help break down calcium deposits in the joint. Next up, remember that magnesium we soaked in earlier? Well, your body needs it internally too. Snack on magnesium-rich foods like nuts, seeds, and leafy greens to keep muscle cramps at bay. And finally, please don't overlook the most basic remedy of all, water. A dehydrated joint is a stiff, cranky joint. Drinking enough water ensures your knees stay perfectly lubricated, like oil in an engine. Let's transition to section 4, movement and body mechanics. These are the proactive lifestyle adjustments that actually protect the joint. Okay, the simplest mechanics equation we can possibly look at is managing your body weight. And I want to share a staggering fact with you. Every single extra pound of body weight you carry adds 4 pounds of pressure onto your knee joints every time you walk or take the stairs. 4 pounds. That is an intense, multiplied stress that severely makes pain worse, especially if you have osteoarthritis. So what does this mean for us? It means that even a very, very small amount of weight loss physically removes a massive amount of load off that joint. It is an absolute game changer. Now, when it comes to movement, you want to think of this as building a muscular shield around your knee. And to do that, you need a 3-pronged approach: strengthening, stretching, and massage. First, strengthening exercises for your quads, hamstrings, and calves actively increase the structural support holding the joint together. Then, you pair that with gentle stretching of those exact same muscles to keep them flexible and relieve tightness. And lastly, regular massage, whether you see a pro or just do it yourself at home with some natural oils, massively improves blood circulation and melts away that deep tissue tension.
And finally, section 5, knowing when to seek help. This is all about recognizing the red flags.
Look, home remedies are fantastic, we all love them. But we have to respect the red flags. If you have pain that is genuinely severe or it just won't go away no matter how much you rest and ice it, you need to call a doctor. The same rule applies if you have swelling that absolutely refuses to go down, if your knee feels visibly deformed or weirdly unstable like it's going to give out, or if you physically cannot bend or straighten your leg. And this is critical. If you notice a fever or your knee feels hot and red, those are major warning signs of a potential infection. In any of these scenarios, do not wait. You've got to get in to see an orthopedic specialist. And when you do go see a professional, keep this guiding philosophy from our source material in mind. Orthopedic care is about treating the person, not just the condition. A good specialist isn't going to just look at a kneecap on an x-ray. They're going to look at the whole picture, the whole you. They'll evaluate your unique lifestyle, what activities you love doing, your health goals, and then they'll build a personalized treatment plan that is actually designed to keep you moving. So, as we wrap up this explainer, I want you to take a second and mentally look over these physical, dietary, and mechanical toolkits we just built together. From throwing an ice pack on the couch, to stirring some turmeric into your tea, or just committing to 5 minutes of gentle stretching, the power to support your own healing is quite literally right there in your hands. So I'll leave you with this. Are you going to let knee pain dictate your limits? Or are you going to march into that pantry and take the first step to reclaim your mobility today? The next move is entirely up to you.